Thanks very much, Rob Byrne. Yes, indeed. We focusing on the vaccine here on the program this morning. Acceptance and hesitancy, looking at both sides of the story. And let's cross back to SK now, who is out in the SABC's parking lot. It's by Radio Park, so that's exactly where she is. That's where the pop-up vaccination site is, open until Saturday. SK, who are you with now? I mean, we've been seeing lots of people actually coming in. I imagine mostly staff here at the SABC and, those affiliated to this, but I can imagine eventually the public will start making their way once the message gets out there. It's over to you.
Indeed, Leanne, and as you say, people are already queuing, and if I just look around to my left, there are people coming through on foot at this point. As you say, some of the SABC staffers, also see some of our security personnel here at the SABC, they are coming through. We've had a few cars drive through because you also have the drive-through convenience, but that happened so quickly we didn't even get a chance to hold them up to speak to them about the experience, but hopefully we will get a chance to do that. It all seems very efficient at this point, and this of course the SABC's pop-up vaccine site in partnership with the Gauteng provincial government. And we will be here until 4 p.m. this afternoon. So this site today, the pop-up center, from 6 until 4, and then tomorrow again from 8 until 4, and also on Saturday from 8 until 4. So feel free to come through if you want to get vaccinated. If you haven't yet registered, if you can, please do so. Otherwise, it's not a crisis. There are people on site here who can still assist with that facility. But I also need to say that if you are still hesitant, and it is your right to either get vaccinated or not, you may come through to even have your questions answered. Some questions that you might have that is causing the hesitancy in you. There are people here, experts here from various departments who would be able to assist with some of those questions you may need to have answered. But right now, I have with me Professor Bruce Mellado. Now, he is a member of the Gauteng COVID-19 Advisory Committee. Professor, thanks so much for coming through, and good to have you here with us on Morning Live.
Thank you very much. Good morning to you.
Professor, we speak about the third wave, which in this province seems to now be in the denouement part of it, but some provinces are still in the third wave of COVID-19. But let's talk about these waves and how exactly do you forecast what is likely to happen when with the virus?
Right, you're completely correct. So if we look at Gauteng alone, what we see is a situation whereby the number of cases and other indicators are dropping steadily. We can say that we are leaving the high risk and the risk area to a situation where we have less risk of resurgence. Now, the problem that we have with the third wave, which is somewhat different from the first and the second, is that our provinces started the wave or peaked at very different times. So the situation right now, whereas in Gauteng the situation is reasonably good, we have neighboring provinces such as where we don't see evidence of it taking place. And probably most worryingly is the fact that KZN doesn't seem to have peaked yet. And that's a very populous province that has a lot of relations with the Auckland Park. So we cannot say that we are already...
Okay, Prof, I believe we just have a little bit of a problem with your mic, but I think as I step closer, trying to keep a safe distance from you, we just lost your mic there. So I'm just going to have to get you repeat that. As you were saying about the Free State, the indications in Gauteng seems to be that the numbers are in the decline, but not in a province like the Free State. Can we pick it up at that point?
Yes. So the situation in Gauteng is that the number of cases and other indicators are steadily going down. We are leaving or have left the high risk area. However, the problem we have is that this third wave is somewhat different from the first and the second, in that different provinces have started the wave or peaked at very different times. So currently we have neighboring provinces such as the Free State, or a case then where we don't have evidence that the peak has been reached. And that is a major source of concern, because there's a lot of movement and communication between the provinces. We are concerned that the fourth wave may actually be accelerated, may come earlier than anticipated, because of the fact that other provinces are still display a very large number of cases. As a result of that, it is paramount to get vaccinated.
So if we look at the Delta variant, for example, as forecasters, people who work on the modeling of what this virus is likely to do, its trajectory, what sort of spanner has Delta variant thrown in the works?
Right, the Delta variant came in Gauteng at the time when we had started the third wave, and then all of a sudden around mid-June it became dominant. And because it's much more contagious, what happened was that in the middle of the wave we experienced a very large acceleration. The problem with the Delta variant is not as much as it is more deadly, it is that it is much more contagious. So it is much more easily transmissible with the same conditions and with the same levels of lockdown. And that is what caught us in a situation where the numbers became very large in the third wave. And the problem with a very contagious virus is that it's going to basically get everywhere. And this basically essentially means that our strategy somehow shifts more towards vaccinating not just everyone, but vaccinating the most vulnerable as soon as possible, so that the impact of the fourth wave is as minimal as possible.
So speaking to that, when you talk about this variant being much more transmissible, what does that mean in real terms? So where we spoke about previously the way the virus was actually transmitted from one person to another, the possible ways in which that can move, the time in which it would take to be transmitted, what does the Delta variant do that makes it so much more transmissible?
Right, so in terms of modeling the pandemic, the transmissibility of the virus is very important, because it tells you, and it is related to the probability of the virus to be transmitted from one person to another. For instance, if somebody doesn't wear a mask, the probability of a more contagious virus to be passed from that person to another is much higher. Also, the efficacy, the efficiency of non-pharmaceutical interventions at any given level become less efficient, becomes smaller. So you have to tighten regulations and non-pharmaceutical interventions to have the same effect. So it's basically the fact that something is transmitting and is being passed from one person to another more with a higher probability in a more likely fashion. It means that we are more vulnerable to the virus. We are less protected, and we need to basically be much more conscious about observing and adhering to social distancing measures. And now that we have the vaccination campaign, now is the time to basically get vaccinated.
And just finally, we're speaking about a fourth wave already. And from what you said earlier, Gauteng, the number seems to be declining by all indicators, but of course some of our neighboring provinces, they don't seem to have even peaked as yet on the third wave. So in terms of the expectations for that fourth wave, what is your model saying at this point?
Right, so we are crunching numbers as we speak. It's a complex calculation that takes into account a lot of uncertainty. So when you model, you have to take into account the fact that there are things that you don't understand. So you have to go around that and use mathematical tricks in order to avoid or at least diminish those uncertainties. So what we can say at the moment is that because the Delta variant was so contagious and it was passed on to so many people, and the third wave was so large, it's unlikely the fourth wave will be bigger than the third wave. It's evident that most of the population have had the virus, have developed some sort of immunity. And when I say some sort, there's a lot of uncertainty in that. We don't know how long that immunity lasts for. So what we do is we create different scenarios with different assumptions, where we assume different levels of immunity as a function of time. We basically assume different levels of severity. We assume different levels of vaccination in order to give government different scenarios for the fourth wave.
And just a final question, is there any indication as per your model, your forecast as to when we are likely to enter that fourth wave in a province like Gauteng?
Right. Unfortunately, mathematical modeling cannot tell you when a wave will take place for a very simple reason. Waves are typically triggered by super spread events. So those are very difficult to predict. Okay. Now, in order to go around that problem, what we do is we have developed already for the second and more intensively for the third wave, early detection algorithms, including the use of artificial intelligence. And those give us up to 2 months time to notice, to say, well, there is something in the data, something has changed, the dynamic is different, and we're likely to have a peak in 2 months. So that's the kind of, so to say, strategy and procedure we follow now, that we cannot really predict when it's going to happen. That being said, the fact that some of the neighboring provinces haven't peaked yet increases the risk for the advent of the fourth wave. It can accelerate the advent of the fourth wave.
Professor Bruce Mellado, thanks so much for speaking to us. Professor Mellado is, of course, a member of the Gauteng Vaccine Council, and talking to us there about his speciality, which is, of course, modeling and looking at some of the forecasts with regard to that. And just to repeat what he said, Gauteng, all indicators seem to indicate that we are out of that third wave or heading out of it. But in some of our neighboring provinces, like the Free State, they haven't even reached a peak yet. And that, of course, increases some of the incidents for further spread of the virus. So we're going to leave it there for now. We're going to take a break, and then it's back to Leanne.